talking about it. So we are going to cover a lot of information tonight. It might seem like information overload. So at the end, if we have questions, I am more than happy to answer each and every one of them. This, like I said, is a topic of passion of mine because I have been probably in the same position that each and every one of you have either been in the past or are currently in now, where you have misinformation or no information whatsoever on what's actually happening within our bodies. And you go to a medical doctor and they tell you something and it's just, you're supposed to listen to them, right? You're supposed to follow exactly what they tell you to do. And that shouldn't be the case, right? You should be able to advocate for yourselves as women, to stand up for yourself, to know more about your health, to know more about your options, because you do have them. Not just, here, take this pill. It'll fix all your symptoms, right? There are more natural approaches that can get to the root cause of what's actually going on and help you feel and function better, not just with your cycle, not just with fertility, but with every aspect of your life. Cool? All right, let's dive into it. So this talk is going to go into all of things cycle basics. We're going to break down all of the different phases, what's happening in each one of those, so that you guys know what's happening in your body each and every day of every single month. We're also going to talk a lot about hormones, what is happening with those hormones throughout our cycle, and how they affect our bodies. We're also going to be talking a lot about fertility, because fertility is important. Even if it's not something that you're thinking about right this second, it could be in your future. And it's important to think about it now so that you don't have fertility issues when you're really ready for that step. We're also going to talk about how chiropractic care can help with each and every one of those other 3 topics and action steps, right? I wouldn't be doing you a service if I didn't talk to you about the next things that we can do to move forward and actually help you when you leave our office, combat those things that you're dealing with. So, understanding your cycle. We talk about vital signs all the time, right? You go in for like a yearly check at your regular primary care physician. You get your vitals checked. Your heart rate, your blood pressure, your temperature, your weight, all of those are regular vitals, and they're called that because it's things that are keeping you alive, right? Things that we need to track to make sure that you are healthy. Well, for women, your cycle is a vital sign. If it's not happening correctly the way that it's supposed to, you are not functioning the way that you should be as women. And there are many, many things that tell us whether our cycle is normal or abnormal. A lot of different ones. Do you guys know if you have a normal cycle? How many of you know for certain your cycle is 100% normal? There's probably only a few of you in this room that I can for certain say, and it's because you have kids. Because there is one key part of the female cycle that has to happen in order for it to be considered normal. And we're going to get into that. The typical cycle. We talk about it being 28 days. We're going to use that for the frame of reference just to keep things simple. However, normal cycle can range anywhere from 26 to 34 days, and that is healthy. So it doesn't have to be 28 days. Everyone is different. 32 to 33 days every month. It is consistent. Longer than what people would anticipate, but it's consistent. And that is within that normal range. And I track my cycle religiously because I want to know what's going on so that I have the best opportunity to get pregnant when that is the next step for myself. So let's break it down. Man, women are confusing, right? This is happening every day throughout the entire month. There's different phases that not only our uterus goes through, but our ovaries as well. And hormones rise and fall throughout our cycle that make all these processes happen. How many of you knew that that's what happens every single month? You go through that entire phase. It's crazy, right? And we wonder why we're so complex, right? Why our brains are just 1,000 miles an hour. That's because all of this is going on. And our brains control all of that. Our brains tell our body that that's supposed to happen. And if it's not happening correctly, we feel off. We feel funky, weird, moody, whatever it may be. But I think we're allowed to feel that way because that's some craziness. So let's talk about it. There are 4 different phases of the female cycle. We call it a period. That is really only the first phase. That is when we are bleeding. Phase 1, the bleeding phase, the menstrual phase. For that 28-day cycle, we're going to call those days 1 through 5. It could be longer, it could be shorter, depending on how long your cycle actually lasts. During this time, 2 key hormones, estrogen and progesterone, are at their lowest levels. This happens so that we do bleed. They drop down right before we start day 1, which is the first day of bleeding. Not spotting, but the first day that you need to use some type of intervention. A cup, a disc, a tampon, a pad, something to protect yourself. That is day 1. Cool? So, estrogen and progesterone, they're at their lowest. At this point, we could experience lower energy levels due to those hormones dropping down because they do a lot to provide our body energy. So when they're at their lowest, we might not feel great. So this is not the time to be super productive or try to be super productive. You might have to be, but don't try to force it. Don't try to go to the gym and lift a bunch of heavy weights because you are going to hate yourself. It doesn't feel good. And that's because of what's happening within our system. This is the time to give your body some grace, right? How many of you just feel awful during that first week of your cycle? Me too. And that's okay. But you have to recognize that that's what your body's going through and take the proper steps to make sure that you're handling that and taking care of yourself. Does that make sense? Okay. Then we move into phase 2, the follicular phase. For, again, the purpose of our 28-day cycle, that is days 6 through 14. Estrogen starts to rise, so you might have more energy and you might be in a better mood because estrogen is responsible for those key things. Your body is preparing for release of that egg from our ovaries. This is the time to get things done because of our better mood, because of our better energy. We feel more productive, right? How many of you feel that in the second week of your cycle? You're coming off your period, your bleeding phase, and you're like, yes, this is the time that I can be super motivated. I have a list and I get it done every single day. I go to the gym and I'm, feel like my workouts are really productive and I just feel overall better, happier, have more energy, you get better sleep. That's because our body is getting ready to enter ovulation, which is that next phase. Ovulation is the part of our cycle that has to happen in order for our cycle to be considered normal or healthy or regular. How many of you know if you're ovulating? Yeah? Good. How do you track it? Cool. Perfect. Yep. So that's what I like to talk about is those testing strips.
I feel like a sharp knife stab in my abdomen until you decide I'm feeling it.
Okay, so I felt it this month too. Sometimes I don't always feel it, but you can tell sometimes where you are ovulating from because it should alternate ovaries every single month. This month, right all the way, I was like, man, that is tough this month. So I feel that too. Some people have it more than normal, but those symptoms also are not a normal experience to be having. Although they might be common for women to experience, right? Those types of symptoms shouldn't happen all the time. It might be uncomfortable, but that severe stabbing pain, not the most normal experience. Because pain isn't normal. For those of you who didn't know, your body should not be going through pain. How many of you knew that? Pain is not a normal experience. It is not. So if you're experiencing extreme pain, some mild discomfort is okay, that's when we need to be looking at getting some things checked out, seeing what's happening. Does that make sense? So ovulation happens in our 28-day average cycle around day 14, roughly the midpoint. That is because estrogen is at its peak. It is now elevated as high as it should, and after ovulation happens, it'll start to drop back down. At this point, progesterone also starts to rise. Estrogen and progesterone are like best friends. How many of you have a best friend? Yeah? Are you guys the crazy friends or are you the more calm friends? Okay, so you are estrogen, okay? Progesterone is the one that comes and calms things down, okay? They're like, that you've had enough fun, let's go home. Okay, that's progesterone. They calm it down. They help to make sure that it does come down when it's supposed to. After that egg is released from one ovary, like I talked about, rotating sides, we will start to notice maybe we're getting a little bit more bloating because that progesterone is going up. We'll talk about it in the next phase. That's what helps the uterine lining build itself up so that if that egg that was released is fertilized, it has a good place to attach in the uterus. Does that make sense? Even though ovulation only happens on one day of our cycle, we have a fertility window. And that is because sperm can last in the female body up to 5 days. So it could be before, after. We just know that we have that window versus the only day that you can get pregnant is that day of ovulation. Does that make sense? Yeah. Then we move into the final phase, our luteal phase. How many of you have heard of the luteal phase? It's like one of the most popular ones to talk about because it's where all of our big symptoms start to show up. That PMS, right? How many of you PMS? And you know it? I was just going to say the same thing. I like to make the joke because my husband knows when my luteal phase starts. He's like, please stay as far away from me as possible. I don't want to be anywhere near you. Because I do. I start to maybe get a little more snippy, even though I don't mean to be. My brain chemistry is all out of whack because I'm going through this phase of my cycle. But I recognize that, and he recognizes that, and he does give me a little more grace during that time, bless his heart. But I also have to realize that I'm probably going to be a little bit crazy, and I have to think, then speak, then maybe think some more. Because progesterone is dominant, it is preparing our uterine lining for pregnancy. Progesterone is the sole thing that thickens that uterine lining, gets it nice and healthy so that we can conceive and have a safe, viable place for that for that egg to be fertilized and attach. PMS, those premenstrual syndrome symptoms, can happen later in that luteal phase. Sometimes it can happen through the whole thing, but generally it's the couple days before you realize that your cycle is going to start over again from day one. So we maybe are experiencing some more mood swings, some higher anxiety, more fatigue, bloating. And the thing that chiropractic care can help the most with, can help with all of those, but headaches and joint pain. I notice that I need to get adjusted a little more frequently when I'm in this phase. Lupe can probably agree as well, that this phase hits people hard. You should see that back office when all of us are in our luteal phase, because women sync up, right? We absolutely have done that. That back office gets a little gnarly. And we're all getting adjusted more regularly because we maybe have a few more headaches or aches that we need to take care of. Do all those phases make sense? Yeah. So, tracking your cycle. Some of you said you track your cycle. How many of you don't track your cycle? Let's start. If I can advise you on one thing, just plug it into your iPhone, right? So here are a couple of the big things that I like to use to track this cycle. The health app on the iPhone, I know the Samsung Galaxy, whatever the Samsung operating system has a similar app or a similar feature. Natural cycles is what I use specifically because it tracks temperature, specifically your basal body temperature, which tracks it to a couple extra decimal points because during our cycle, when we are ovulating, our temperature will spike. That's what tells us that we are ovulating. Flow, clue, they're all very similar. Those two are very similar. They like to track symptoms. They track when your cycle's happening, and the more data that you put into it, the algorithm can become more and more and more predictable so that you know when certain things are going to happen. Does it? Awesome. That's great. Great. That's fantastic. Truly, that's one of the most accurate, as well as ovulation test strips, because those literally test your urine for luteinizing hormone, which spikes at the same time estrogen spikes. So it tells us that our body is or is not ovulating. And then tracking symptoms and cervical discharge every day to note when those changes are happening, because that's also very important. We can tell that our body is just experiencing different things and things are coming out a little bit different. Now, our hormones. Hormones are such a popular topic of conversation right now because everything in our body is controlled by some type of chemical or some type of hormone. There are 5 big ones that are either directly associated to our cycle or influence other hormones that are directly affecting our cycle. Those are estrogen, progesterone, and testosterone. Those are those reproductive hormones that either control something in our cycle or help something else function in our cycle. And non-reproductive hormones, cortisol and thyroid hormones, that influence the other 3. So let's break them all down. Estrogen. It is not just a reproductive hormone. It doesn't just control things that happen in our cycle, but it helps to maintain bone density, support cognitive function and mood. It helps to influence where our body stores fat. So we can see that if estrogen is not in proper balance, it's not rising or falling at the correct time, it's not being released at the right time, we can have some symptoms, some problems that we are experiencing, right? We might not ovulate. We might have body fat that's storing in different places that we don't want it to be. That can be a key indicator that we have estrogen imbalance. We might have poor cognitive, just feeling. You might feel foggy, off. Your mood might be down or super high all the time or in disbalance. Those can be key indicators that estrogen isn't balanced. Progesterone. Remember we talked about progesterone being that calming friend? It is known as the calming hormone. Because it tames estrogen, it balances it out. It also helps to support sleep and anxiety. If we don't have that progesterone rise when we're supposed to, we could feel more fatigued. Our sleep might not be as quality as it should be. We can also experience more anxiety, which is not what we want. It also helps to maintain that uterine lining. So if progesterone isn't doing its job, isn't rising when it's supposed to be, we might not be able to either completely get pregnant or maintain a pregnancy, because that uterine lining provides nutrients and support and a good home so that that fertilized egg can grow into an embryo, into a baby. If that uterus is not a viable space for that, we aren't going to be able to maintain that pregnancy. And progesterone is a key component of that function. Testosterone. Testosterone can be kind of scary for women to talk about, right? Because you think of it as the male hormone, right? How many of you think that if you have way too much testosterone in your body, or if you just have testosterone at all, you're just going to become some big beefy dude? No. It can, absolutely. But just like men have estrogen in their system, women have testosterone. It's just at different levels, which is okay because it does some pretty awesome stuff. It helps maintain our muscles. It helps our bone health. It helps our brain function and our sexual function and desire. It helps us make us women, the women that we want to be. it plays a key role. And if that is not properly balanced, we can absolutely notice some not so fun symptoms. Cortisol, the stress hormone. This is probably one of the biggest ones that I hear all over social media because stress is a huge part of everyone's life. I have never met a single person who doesn't have some aspect of stress within their life, whether it's small, huge, whether you perceive it as different things. Everyone has stress. Even if it's not so bad, all the time, it can elevate and fall throughout every phase of our life. Cortisol is that stress hormone. Chronically elevated levels of cortisol can drastically affect our cycle because it can alter ovulation, so it affects estrogen and progesterone. It can affect menstrual flow. We could either have amenorrhea, so no flow at all, or really heavy flow. It can affect our timing. How many of you have noticed that if you are super stressed, your cycle just doesn't appear? Yeah. Or you maybe get it twice in 1 month. Yeah. That can absolutely happen. And it's what the heck? I just bled 2 weeks ago. Why is this happening again? Well, you have to think back. Have I been extra stressed? That's probably the number one reason. It can also have an effect on regularity, pain, as well as your absorption of certain vitamins and minerals. If we have really high levels of stress, all of our energy is going into that production of stress hormone because it's super high. So our body doesn't have as much energy as it needs to for other life functions, like digesting food and absorbing the right things from that food that we're eating. So it's important to have our cortisol levels assessed to know if they're too high and how we can combat that. We'll talk about it a little bit later. Thyroid hormones. How many of you know what your thyroid hormone levels are or have had them checked or looked at in any way, shape, or form? Great. Now, there's multiple different areas where thyroid hormone comes out. It doesn't just come out of our thyroid. It actually also comes out of our pituitary gland at the very base of our brain stem and goes into that thyroid gland and affects how that is being produced, those different hormones. Let's talk about the two things that can happen with thyroid hormone. Now, it can get a little bit confusing, so listen closely. Hypothyroidism is a lower level of thyroid hormone. It can actually have an elevating effect on our symptoms. So it means more pain, more symptoms, heavier flow, irregularity, can all be associated with lower levels of thyroid hormone. Does that make sense? Yes. Hyperthyroidism, or elevated levels of that thyroid hormone, can have a dampening effect on our symptoms and our cycle, meaning we could have less bleeding days, no bleeding at all, multiple months of no bleeding, and then a couple months of bleeding, and it can just have that type of irregularity. Either way, it's something that needs to be assessed if that's what's happening to our body. That's why it's so important when we have cycle irregularity, when we have abnormal symptoms, either in the extreme sense of it, a lot of bleeding, a lot of symptoms, a lot of cramping, we need to get those checked, but also not bleeding enough. I know that sounds crazy, right? Only bleeding for 1 day, that sounds awesome, right? Sounds great. But a normal cycle should last anywhere from 4 to 8 days. Anything less than 4 can be problematic, and it's something that needs to be assessed because the female body needs to shed what's inside of it. And 4 days is, for whatever reason, the time that is normal for that to happen. Now, subtle imbalances in these thyroid hormones can affect our cycle by affecting estrogen, progesterone, the regulation of both, and it can affect, like we talked about, our fertility, our cycle regularity, weight, energy, and mood. Thyroid hormones probably have the most play on how our body stores fat, how we can lose weight, our energy, and our mood more than most other hormones. So it's important to have those checked and maintained and watched if they are having any types of imbalances shown. How am I supposed to know? Do I just walk around and, I've been experiencing this for most of my life, or a good portion of my life. That's just normal for me, right? It's like saying as you age, I'm just going to be experiencing pain and that's normal. If you feel like there's something imbalanced or abnormal, it probably is abnormal. And it's something that is worthwhile checking out to see what is going on, because you deserve those types of answers. Some common signs that we see are irregular or severe PMS. I say irregular by maybe you have crazy mood swings 1 month, but then the next 3, you're totally fine. And then another month, you have, again, those crazy mood swings or a lot of cramping or a lot of pain during your cycle. Those are things that need to be assessed. Unexplained weight changes, persistent fatigue, mood swings, anxiety, and depression, sleep disturbance, hair loss or skin changes. Those are the biggest ones that we notice when testosterone is out of balance. And fertility challenges. It's very important because hormones play obviously a huge role in our entire cycle. And if we're struggling with fertility in any way, shape, or form, having those checked to know what's happening is going to be so important. Speaking of fertility, it is the whole reason why we go through all of this every single month. Whether it's your goal or your plan or not, that's why we go through this, so that you can conceive and have a healthy baby and a healthy pregnancy. Fertility could be affected by those abnormal hormonal levels. Stress, right? We talked about that cortisol. That can affect just about everything within our body. Our uterine function. Reproductive organ disorders like PCOS, polycystic ovarian syndrome, endometriosis, and uterine fibroids. Now, uterine fibroids are a benign mass that sits in our uterus. Not everyone has them. Some people do. Comes at different sizes, different variations, but that is something that just takes up space in our uterus, meaning that there isn't enough room for a pregnancy to grow. Endometriosis is the tissue that's in the uterus growing outside of where it's supposed to, and that can cause a lot of pain and stress to the body. PCOS, that polycystic ovarian syndrome, comes along as an overarching term for a whole lot of diagnosis problems. So when people have irregular cycles, when they have hormonal imbalance, when they do actually have cysts on their ovaries, or when they're having any type of issue with their cycle, 9 chances out of 10, they'll tell you you have PCOS. That's actually what happened to me. That's why I'm so passionate about what I talk about. While I was in chiropractic school, went off of birth control, gained about 20 pounds, went into my OBGYN. She told me, well, you probably have PCOS. We'll just put you back on birth control. That'll fix everything. Doesn't sound right. I don't want that answer. Nor do I want any of you guys to have that answer, right? Because I don't think it's an acceptable one. I think there's other things that could have been asked of me or checked or, assessed in some way, shape, or form to know why that happened, right? I was under a lot of stress. That probably had something to do with it. I was busy studying and in school all the time that I wasn't necessarily eating the best or exercising as much as I should. That probably also had something to do with it. But those questions were never asked. What are you doing? Are you working out? Are you eating healthy? Nope. It was just, you have PCOS, birth control is your only option. So I took it upon myself to learn about all of this stuff, because I don't want to have to go through that again, nor do I want any of you guys to go through that, ever. So I want to educate as much as I can so that doesn't happen, so that you can have the knowledge and the confidence to walk in and ask those questions. Well, why? Why is that the answer? Why is that the only choice? There's got to be other options, right? That's why it's so important to me. for people to understand. And not just women, men too, because they play a huge role in everything that we go through. So let's talk about the nervous system, because I'm obsessed with chiropractic and the nervous system, so obviously I have to talk about it, and how it's connected to our hormones. What does chiropractic care have to do with any of the things that I just talked about? It has a whole heck of a lot to do with it. Because our entire body, every single system and process that it goes through is controlled by the nervous system. The brain, the spinal cord, and the nerves that come off of the spinal cord. Everywhere in our body, jeepers, it's telling us how we're supposed to function. Specifically, in our low back, those nerves go into our vital reproductive organs. Our uterus, our ovaries, everything that's happening down in that region is controlled by our brain and our spinal cord and those nerves. And if it's not working the way that it's supposed to, if there's some miscommunication happening, do you think those organs are going to work the way that they're meant to? Heal the way that they're supposed to? Operate how they should? No. That's where chiropractic comes in. This can be a little bit confusing, but we're going to go through the whole thing. So, chiropractic care and our bodies specifically are all based on performance. Our specific performance. Because I'm different than you, Sam. Sam, you're different than Katrina. You're different than Morgan. Everyone is different. Okay? I don't function the same as anyone in this room. No one does. That's why chiropractic care is so cool. It focuses on what our body is capable of. Our human performance. That is regulated and maintained by our body's chemistry, hormones, and how those are flowing and functioning within our system. If they're out of balance, our human performance automatically diminishes. We are not functioning at 100%. Those hormones are produced by glands within our body. They are everywhere, and they control just about every function that our body goes through every single day. Those glands are controlled by our master control center, our nervous system, our brain, our spinal cord, and those nerves. That master control center is protected by bone, the bones in our spine. What does chiropractic care do? Take care of those bones. Because if they're not where they belong, it's going to cause some grief. That is what is called the vertebral subluxation. If you're a practice member in this practice, you better know what that is. If you're not, it's when the bones of our spine move from where they should be. That puts pressure onto that master control center, meaning the glands are not being properly communicated to, our hormone levels are diminished, and our human performance goes down. We don't function how we should, right? Maybe that's our cycle, right? We are talking about it. Irregularity, hormonal imbalance, heavy bleeding, cramping, all of those things are out of whack because our chemistry is not balanced. Does that make sense? Well, let's correct it with an adjustment. That adjustment helps to make sure that those bones are back in proper alignment so that our master control center doesn't have any miscommunication occurring. So those glands can function the way they're supposed to. So our body chemistry can be balanced and our human performance is back at 100%. Sounds pretty awesome. Simple. Easy. Chiropractic is amazing in that regard because it helps us not only with aches and pains, but everything else, which is why it is such a key component of setting that foundation for a good, healthy cycle and making sure that it continues to function the way that it's supposed to and maintains our whole body health and wellness. So that is why chiropractic adjustments can help with reducing those cortisol productions, managing our stress levels, improving our nervous system regulation so that those body chemistry hormones can be well balanced, enhancing blood flow to those reproductive organs so they can heal the way that they're meant to, support proper pelvic alignment. That comes in big with pregnancy and the Webster technique. There's a little chart on the back page of your packet that talks about the Webster technique and what it focuses on. We're going to go through that in just a couple seconds. As well as decreasing inflammation that can disrupt hormonal imbalance, making sure that we are properly functioning, and so many more things. So what now? I just told you all this stuff. Let's talk about how we can start implementing things today to make sure that we function. How nutrition, good quality lean proteins, healthy fats, great carb sources, fruits and vegetables, eating as clean as possible when you can. Hormone balance, chiropractic care. We're going to notice a theme. Chiropractic care is so important, like we just talked about, balancing our body's chemistry. Prioritizing quality sleep and stress management. Setting a good bedtime routine, a good wake-up routine, even on the weekends. I know it's hard. On the weekdays, I am awesome at a bedtime routine and a wake-up routine. 9:30 to bed, 5 a.m. to wake up, because I got to go work out. The weekends, out the window. I got to be better about that. But making sure that it's consistent is so important. Stress management. I always tell my patients, do the things that you love to do that make you feel less stressed, and do them as much as you possibly can. Because that helps so much with stress management. Supporting liver health through nutrition. Again, that goes back to eating good quality foods, lean proteins, good carbs, healthy fats, because all of our hormones are filtered through our liver. Maintaining a consistent exercise routine that includes strength training. Now, I know for the longest time, women were told cardio, cardio, cardio. That's what gets you healthy. But too much cardio can actually inhibit hormonal production. And strength training is super important to enhance hormone production. I'm not talking going to the gym 7 days a week and pumping some major iron. I'm talking about some slight resistance training 3 to 4 days a week. Minimizing exposure to endocrine disruptors. Those are those BPAs. So BPAs in plastic, any food additives, pesticides, parabens, and chemicals from makeups, fragrances, all of those types of things. They can drastically affect our chemical imbalance. Fertility support. Pay attention, because this is where it gets real good. Chiropractic care. Beginning prenatal nutrition at least 3 months before trying to conceive. Now, ladies, it is not all about you. It is, but it's not in this case. Okay? Men are so important. How many of you knew that sperm health and morning sickness go together? Yep. There are proven research studies that show the quality of sperm, that is 50% of what is contributed to a pregnancy. If that sperm quality is low, your chances of morning sickness go up drastically. The healthier we are, the more it goes down. I have my husband on that game already. He takes his multivitamins, he eats healthy, he exercises, because I don't want to be sick for 9 months. Not fun. I'm not doing that. So he is healthy. So if you went through a pregnancy and had morning sickness, you can blame it on your spouse. Something else that we can bring home, right? Definitely. Tracking your cycle to identify those fertile days. Ovulation test strips, tracking your cycle through one of those apps, tracking your body temperature, all of those things can help know when you're fertile. And managing stress. The more stressed we are, our chances of conception go down, as well as maintaining that pregnancy if it does occur. As Morgan hears her 2 kids in the back. Chiropractic care throughout pregnancy is also one of my specialties and one of the things that I love to talk about and love to focus on, because pelvic health and soft tissue structures that surround the pelvis have a lot of change during pregnancy. And so keeping up with those, especially as we get closer and closer to a delivery date, is super important, because it not only helps reduce labor pains and help progress that labor a little bit faster, but it also helps just overall your pregnancy feel better. You don't have as much pain. You have a better opportunity of having a baby that's head down, because we're setting good places for our baby to be in the proper positioning. We don't have as much pain because we're working on those round ligaments in the front and our SI joints in the back to make sure that that entire pelvic outlet is round where it's supposed to be, so baby's head has the best chance to exit that birthing canal properly. Now, again, I wouldn't be doing you a service if I didn't give you an action step to move forward, to truly help you set a great foundation for everything with your whole body: health, wellness, fertility, cycle, all of the things that help you be a better version of you. For this event only, it ends the second you walk out our door.